Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about what we look for in a first trimester scan. So, first thing is we are looking to make sure that the pregnancy is actually inside the uterus. So, we want to make sure that the gestational sac is seen within the uterus and it is not implanted too low in the uterus. We also want to make sure that it is not a pregnancy that is outside the uterus, which would be an ectopic pregnancy. Secondly, we do want to be able to see a yolk sac. So if you are over about 5.5 weeks or so, we should be seeing a yolk sac, which is a circular structure that appears before the placenta develops and that essentially acts as a nutrient sac for baby until again the placenta actually takes over. Third, we are hopefully going to be able to see baby during this dating ultrasound if you are far enough along in the pregnancy. If you are in that 5 to 6 week range or before 5.5 weeks, we may not be able to see the fetal pole just yet because it is simply just too small. Doesn't mean you're not pregnant, doesn't mean that the pregnancy is anything to be concerned about necessarily, but most likely you are just too early along to be able to see the fetal pole yet if you come in too early in the first trimester. But with all things considered, hopefully we see the fetal pole during this ultrasound scan. And we want to make sure that baby actually has a fetal heart rate as well. So, just to recap, we want to make sure that not only do we see a fetal pole, so basically a baby, we also want to be able to make sure and actually see a fetal heart rate on baby. We're going to measure the crown rump length of baby, which is essentially just the measurement from head to bum, and that is going to give us a gestational age. So essentially just how far along the baby is, and then that will give us a estimated due date. So just like the name implies, a due date that we are estimating based on how far along baby is at that first scan. And we are also going to measure baby's fetal heart rate just to see how high or how low it is. And the normal range is between 110 and 180, but it can be higher or lower depending on baby's age, and it can still potentially be normal. But basically, 110 to 180 is the normal average range. We are also looking at the maternal structures, such as the ovaries, just to see if there is a corpus luteal cyst, which is something that develops when there is a pregnancy present. We don't always see this, but most of the time we do. We also want to check for any sort of abnormalities in the uterus, such as fibroids, a subchorionic hemorrhage, or a uterine bleed. And we also want to make sure that all the rest of the structures in there are looking as they should. So, just looking for any sort of pelvic masses, as well as making sure that any sort of free fluid, etc., is documented as well. Hopefully, this has been helpful in your ultrasound journey throughout your pregnancy. And if you found this video informative, please consider subscribing as well as liking this video or leaving a comment below if you want me to do any other specific pregnancy video. You can also find me over on TikTok as well for more ultrasound content.